Welcome to Careers in Discovery, where you'll meet scientists who've forged outstanding careers in biotech and hear about what they've learned along the way. This podcast is brought to you by Singular, building brilliant biotechs. Rebecca Godfrey is the Chief Operating Officer of ExpressionEdits and the author of The Leadership Vaccine. Rebecca talked to us on Careers in Discovery about her journey from Immunology PhD to COO, figuring out who you are professionally and why she loves her job. This week on Careers in Discovery, I am absolutely delighted to be joined by Rebecca Godfrey of ExpressionEdits. Rebecca, welcome to the show.
Thanks so much, Tom. Look, thanks for having me.
Really pleased to see you and very much looking forward to getting into the story of your career. It's a very interesting one. We always start by talking a bit about what you're up to now. So Rebecca, if you could start by telling us a bit about ExpressionEdits and the business and what you do there.
Yeah, absolutely. So I'm the Chief Operating Officer at ExpressionEdits. We are a biotech startup spun out of the University of Cambridge. And we're based just south of Cambridge in Haverhill. And we have developed a proprietary platform that significantly improves transgene expression. Now, the company's been established about 2 years, but we've been operational about a year. There's currently 9 of us, soon to be 11, which would be lovely, and a really nice mix of wet lab and dry lab or computational lab in the team, but a huge amount of experience. And what we've been really keen to do is bring on people who have significant experience and hands-on experience in their respective fields.
Yes.
So it allowed everyone, as soon as they joined, kind of the end of last summer, early September, to really get going quickly. So so it's been a very busy year, but a fantastic one.
No, that's good. And presumably then in that sort of organization where you're hiring a small group of very capable people, you're focused on trying to allow them to do what they do best as much as possible. And I'm guessing a lot of that falls on your plate, Rebecca, but tell us a bit about what being the COO involves for you.
Yeah, absolutely. And just to your point, one of the things that really attracted me to ExpressionEdits was our CEO's approach. She's very much, shared accountability, shared responsibility, allowing those with the various different expertise to really, live and breathe their role and build their departments of the future, even if their departments at the moment are an N of 1.
Yes.
Now, my role here is, I say that I'm the non-scientist. I get in trouble for saying that because I do have a PhD in immunology, but the way I describe my role is I do all of the bits that aren't the science. So running the day-to-day business, everything from finance to HR to operations, supporting lab management, health and safety, information security, all of those things. But also one of the parts of the role that I love is that I lead all of our business development activities and support the CEO with her activities with investors. So it's a really mixed bag, my role, but I absolutely love it. And as I say, one of the things that really attracted me to this company is when Cart, our CEO, was like, right, come on board. You've got this expertise, now run with it, which is really, really nice. So yeah, it's been, as I say, it's been busy, but really varied. And, we've built a lot of systems and structures over our first year, which really allow us to be very efficient, very, work with really good speed, but also making sure that all of our data is safe, there's high integrity, high quality, and all of that, which is something I'm passionate about.
Yeah, absolutely. And we're going to talk a little bit about how you got to this point and the journey that you took. And, we'll probably get into this a little bit as we do that. But I suppose I was interested in, as a scientist by training, even though, as you say, you refer to yourself as a non-scientist. This type of work, what is it that really appeals to you about it? What is it that you really like about doing this type of operational role?
I don't know. I think somebody once said to me, you're either a builder or a fixer. And when I look across all of my roles, which now, no doubt as we go through this conversation, will sound like a very linear process. It really wasn't. But I think in all of my roles, the commonality is either I've been brought in to build something from the ground up,
Mm-hmm.
or I've been brought in where there's a significant change or a significant challenge and it's rebuilding. And that's what I love about the startup world,
Yes.
because you get, it's like, it reminds me of hill walking when I was a teenager. You think you're at the top of the peak, you get to the top of the peak and you see the next one, you see the next one. And that constant challenge I really, really love.
Mm.
I also am incredibly passionate about what we're aiming to deliver at Expression Edits and in the wider biotech. I've got very personal reasons as to why I want to get, incredible treatments to patients. Um, the the thing that frustrates me is when there's inefficiency,
Right.
or when there's duplication or unnecessary churn. And I think that over the course of my career in operations has really been my guiding light. How can we allow people to move quickly, efficiently, with speed, but at all times maintain really high data integrity and quality? And
Yes.
that all comes down to the operational, making sure you've got the right systems and structures in place. And I think in the startup world, that's particularly challenging, because you want to build these structures, you don't want to build too much and slow everyone down by essentially becoming a bit of a mini corporate entity,
Yeah.
but building enough so people just know what they bring their expertise and they can run fast and safe and really know where the boundaries are. And so a few years ago, I read a book called Rocket Fuel, and it talks about the visionary and the integrator
Mm-hmm.
relationship. And it was like a eureka moment, because I was like, that's me, I'm the integrator.
Okay. Yeah.
Visionaries have these amazing ideas, and what I love doing is being okay, you've got this great idea, right, let's make sure it comes to life by building a business around that.
Yes.
So I think that variety and challenge together is something that really is all about me.
Interesting. Yeah. And I think I imagine again we'll get into this a little bit more as we talk about your career, but I think that's something that people often struggle with as they go through their career, is figuring out what is the actual role that they're going to not only be best at doing, but that they're going to be happy doing, and how do they fit in the overall picture, and how do they play to their strengths. And I think sometimes there are these prescribed career paths, then if that's not the career path for you, then it can be difficult to find the
Yeah.
other things that do suit you, right? But it sounds like there's a moment there that made that really clear to you.
Yeah, absolutely. And I was actually talking to somebody in the early stages of their career just this morning.
Mm.
And they've got a plan on where they're going. And I said, be open to, things coming out of the blue, or if you know where you want to go, there might be 25 different ways to get there. And actually, one of those may take you down a path that you didn't expect to be.
Mm-hmm.
I didn't expect to be a CEO of a biotech company. I'm so glad that I am. I love where I am. It all makes sense. It feels like the perfect fit. But if
Yes.
you told me 10 years ago this is what I'd be doing, I'd be thinking, how on earth am I going to get there? I think it's like, it's also, I think, important, and this is why I love your podcast. I think it's really important to tell career stories, because I
Mm.
think LinkedIn is like the professional Instagram. You can look and it looks like, oh, somebody's career was so easy and it was all mapped
Yes.
out and it was all planned. It doesn't tell of the difficult decisions, the failures, the challenges, the dead ends and having to start again. It just, so for those earlier in their career, it can actually look really, difficult to
Yeah.
aspire to that. And so I think telling the stories is really important, because there have been times where now in the last maybe 5 years, things that, I was thinking, oh goodness, this is really bad. Going, remember, you felt like this before and something good.
Mm.
And it's almost like that, parent or that grandparent telling you, it'll all come good in the end. They say that because they know it does. They're
Yes.
right. I always say, I hate to now realize how right my mum was when I was younger. I get to say that to my kids now.
There you
But
go.
yeah, I
There you
think
go.
these stories and the stories that I've heard on your podcast have been really inspiring to me as well, because you think it's not just me that's having these challenges or difficult decision making or whatever.
Yeah, and I think it's easy to look at people who are in senior positions and who are 10 years ahead or 15 years ahead or 20 years ahead in their career, and not be able to see how you become that person, right? But
Mm.
then forget that they've had all that extra time to learn and develop, and they haven't just gone in one step from being whatever, a senior scientist or a postdoc, to being a CEO or what
Yeah.
have it. It's all little improvements, little learns, little bits of development that add up.
Yeah, and also things like I was talking over the weekend with my husband, with ChatGPT now and
mm,
AI, we don't know what careers are going to be around in
mm,
5 years now. It's getting our view, our window of what we can see is getting shorter and shorter. But if you think about it, when I finished my PhD 17 years ago, there you didn't see founders coming out of PhDs and
mm.
postdocs. So actually, the job that I do now, being the partner to that science founder, didn't actually exist.
Right.
So some of the roles, if somebody is earlier in their career, the role that they may have when they're at my stage of the career may not yet exist. And that's why when people do the where do you want to be in 10 years, I'm like, I don't know. I can tell you where I want to be in a year.
Yes.
But who knows 10 years? And I think that question will almost have to be, completely taken out, because I don't think anyone will know where we are in 10 years. I don't. And I'm
Yeah.
well way into my career. So yeah, I think that's also really interesting. There are job roles and job titles and organizational setups now that didn't exist 5, 10 years ago.
Absolutely. And I think 10 years is an interesting time period, right? Because, you look back 10 years ago and so much has happened, whoever
Mm-hmm.
you are, right? So much has happened in that period of time that
Mm-hmm.
it's hard to imagine kind of how you saw the world even 10 years ago, even for yourself, right? And so,
Yeah. Especially when you've got kids, and I look back, and my eldest is 11.
yeah.
So 11 years ago was a different world.
Uh-huh. Yeah. I
Of
understand.
course, I haven't aged at all, but
No,
but
no.
it's so different. But yeah, the industry is completely different, which
Yeah.
is it changed for the good, which is really good.
Yes, absolutely. So that's a lovely link to take us back down to the beginning of your career and the early days and the origins.
Mm,
Um, so I always ask this question, but you trained as an immunologist originally.
mhm.
Um, for you, Rebecca, why science? Why immunology in particular? Why this industry? What was the sort of the starting point for you?
Well, I wanted to be a vet. That
Okay.
was the dream. My parents had very different careers to what I have. My mum was now what you would call a serial entrepreneur. At the time, I just thought she had lots of different jobs. So she
Hmm.
was she was a restaurateur, she had a gift shop, she had lots of different careers. Growing up in Ireland in the 90s, she was a single parent. Divorce was illegal, so we were the only single parent family in both my primary and secondary school. And she was a real, she was somebody who would constantly, reinvent herself, especially the recession in the early 90s was very, very difficult in Ireland for any business owner.
Mm.
But her father was a vet. And so we used to spend a lot of time with my grandparents. And not only was he a vet, but he was a Labrador breeder. So
Okay.
you'd go to his house and you'd get to lie on the floor in the garden with 20 puppies all over you. It was a dream. I've had Labradors my whole life, right up
Right.
until today, because of that. And I always wanted to be a vet. So growing up, I did work experience during secondary school with a veterinary surgeon. My dad lived over in the UK. He had a very different, he was a TV and radio presenter. So he had this dream of me doing a science degree and being the next Tomorrow's World presenter.
Uh-huh.
You
Yeah.
remember Tomorrow's World? That was his dream for me. Um, but I decided I was going to do veterinary, but getting into veterinary in Ireland is incredibly difficult. There are
Okay.
very few places, and you can imagine a lot of interest with such an agricultural country.
Yes.
So I thought, well, I'll do biology first, and then I'll transition over to veterinary. But in Ireland, you can't do a well, certainly when I was going to uni, you couldn't do a biology degree. You could only do science. So you do
Hmm.
physics, biology, chemistry. And I am no physicist. Definitely not. So I came over here to do biology with the full intention to go and do veterinary afterwards.
Right.
But when I was doing my degree, and I think it came down to an individual, it was the lecturer of the clinical immunology and the molecular and cellular immunology courses. The two professors were just my favorite teachers. They
Hmm.
were brilliant. They would talk to you not just about the subject, but about the industry and things like that. And I was just really fascinated by it. And so I thought, maybe I want to go a little bit further, a little bit deeper. I'll
Yes.
do my PhD and then I'll go to veterinary because, of course, I have
Hmm.
time in the world. And between my degree and my PhD, I worked for a year at Abbott Murex.
Yes.
Um, and we were producing monoclonal antibodies.
Right.
So
Yeah.
in full paper suit, paper hat, face mask. Yeah, I think the tops of my cheeks were the only part of my whole person that was exposed. But it was great being in the lab, and it gave me two experiences. One, which was hands-on lab experience, because I didn't actually get a lot in my degree, but also the time to really look around for my PhD. And I applied for a couple, but it was the Babraham Institute, long before the Babraham Research Campus was what it is now. The Babraham Institute had a range of immunology PhDs, which I was really interested in. And one in particular, which was very broad, which was the development of B cells in vivo and in vitro,
Okay.
which was the one that I then applied for and was really fortunate to be selected for. And so, yeah, so after a year of being at Murex and really, and I think that's where my kind of operational brain started as well. I went into my PhD with a very industrial mindset.
Yes.
I remember my supervisor teasing me because my lab book was perfectly written with like I'd write the batch number and the expiry date of everything. I just always had that because that's what's drilled into you in a GMP environment.
Yes.
But it was a great start into my PhD, and it meant straight away I could get in the lab, and I had confidence that I hadn't had the year before, straight out of undergrad. So it was slightly less exciting gap year than traveling around the world, but it was really, really helpful.
Yes.
But as soon as I went into my PhD, I just absolutely loved it. And again, I was incredibly lucky in my PhD to have a supervisor that was very open to students' ideas. And I was kind of working on one particular project and read a paper and felt that in this paper they kind of, I was like, I think there's something there. I think we need to dig deeper there. And my supervisor said, if you want, Rebecca, off you go. And it turned out that we were onto something. And so my PhD started off looking at the development of B cells very much from a proliferation and differentiation perspective.
Yes.
But ended up going into antibody repertoire and looking at antibody selection, which was fantastic. And it was very successful in the end because we ended up getting a science paper out of it. It was brilliant. But yeah, it was great 3 years. And Babraham was fantastic as well because you had all the great things of academia. But again, it felt like a workplace. It had that kind of professionalism to it. Like I was going to work. I had, there were loads of other PhD students in my year. So I had that peer support as well. So no, it's really good.
Yes, absolutely. And then you stayed in academia for a little while after that.
Yeah. So, and again, I think this is where the industry's changed. Toward the end of my PhD, it had been quite a tough time personally, my PhD. The 4th of June in my first year, I remember being in the flow cytometry lab and saying, this is the best day ever because I got my first result. It was a Ki-67 proliferation assay. And I remember thinking, today's the best day ever. And one of the PhD students ran in and said, your dad's coming up, don't leave. And I remember thinking something's happened. And I thought my grandfather had passed away because I knew that he'd been ill. And my dad lived about an hour away from Babraham. So he drove up and I found out that my mum had died very, very suddenly. She was 52. She no illness that we knew of. She developed a bit of asthma. She was giving up smoking and she developed a bit of asthma and she died from an asthma attack. And so my 3 years at Babraham, I was so focused because I think I took 4 days off. Went back and I was very much like, well, a PhD is easy in comparison to that. Like that was awful going through that. But it meant that I was so laser focused. I think it took some of the joy out of the research because I would get in at 5 a.m. I'd work till 10 p.m. And all of the Babraham folks were so supportive and were like, Rebecca, should you take a break? And I was like, no, I'm going to get this done. And also because I couldn't move home when my funding ended, I had to finish in 3 years because we'd sold my mum's house in my second year. So I finished in 3 years and I was starting to think, actually, I don't know if I want to stay in academia. I think after this, I think I want to move. And I think that experience, I wonder sometimes looking back, had I not gone through that personally during my PhD, would I have stayed in academia? Who knows? But my supervisor at the time said, try a postdoc because if you go into a postdoc and you don't like it, you can leave. But if you go into industry, you might not get back in.
Right.
And I think that's what's changed. I think now there's a lot of industry roles that are pure research that people do move between academia and industry, but certainly not then. So I was very lucky to get the UCL postdoc, and
Mm-hmm.
I literally started the day my funding ended from my PhD.
Okay.
A wonderful lab, but again, I would say 4 or 5 months in, I was like, no, I don't think this is for me.
Right.
I really don't.
No, fair enough.
So it was a very short stint at a postdoc, but I'm really glad that I did try, and I was able to, give value to the team, to the lab while I was there, even though that short time. But yeah, it kind of confirmed to me that I wanted to go into industry.
No, that makes sense. And I think with the background that you had at that point, a lot of people would assume that the sort of logical step would be to go into industry in an R&D role in a drug discovery team, in a biotech or a pharma company in the lab. But you took a slightly different route into industry. So why drug safety? How did that happen? Tell me a bit about that.
Well, obviously, it was all incredibly well thought through and
Yeah, of
researched.
course, of course.
It wasn't that I went on the website and it was the first job I saw. Who would do that? Well, I'd heard of Roche, really positive things of Roche, through, I think it was through some people in the lab that they were some way connected. And I just happened to go onto their website, and it was literally the first job ad that came up, and I was like, oh, I've got all the right qualifications. And it just sounded so interesting.
Mm-hmm.
And I thought, well, I'll throw my hat in the ring and see what happens. And I didn't apply for anything else. And what was brilliant is when I went in for an interview, because it was a full assessment day, you got a real flavor of what the job could entail.
Right.
So you're looking at dummy case reports of people reporting side effects. You were looking at how you would process them. And this was all to look at your attention to detail and all of this kind of stuff. And I just absolutely loved it. And, so many years after then, when I was a senior leader in pharmacovigilance or drug safety, I always used to kind of almost chuckle to myself when people in interviews would be like, I know exactly what drug safety is, because actually very few people know, or certainly then, because it was before. Now I think you can do a master's in PV, but back then nobody really knew. So it was more like, what are the things you're interested in? And I really enjoyed the interview process, because they were more kind of like, what are you interested in? What are you looking for? Rather than why this?
Yeah, okay.
And it was great. I went in on a training program. So a load of new starters started together. You'd be with a trainer first couple of weeks. And I suddenly realized how much more complex it was than what I'd thought. And I went into case processing, and it was very much taking these clinical reports and putting them into a database.
Right.
And going from, and I remember it was actually just after I joined there that I found out my paper had gone into Science. And I remember saying to the lady sitting next to me, who was one of my closest friends and the godmother to both my children, saying, oh my God, I've been published in Science. And she went, what does that mean? Do you get money? And I was like, it's like getting an Oscar. That was the best way I could describe it. I remember thinking, what have I done? Have I completely wasted this opportunity? Because by then I'd already moved into this, but it was nice nonetheless to find out while I was there.
Yes.
But not long after I joined, like literally within a few days, I saw that they were sending folks out to India, because they were starting to outsource to a third party in Mumbai.
Yes.
And I'd been to India on holiday a couple of years before. And so there's a few moments in my career where it's like my mother's spirit jumps in my body and makes me do something, because she was a lot more confident than I was. And I remember just walking up to the lady who was sending people out saying, listen, I'm Rebecca. I've just started. I know I don't know my job yet, but if you're ever looking to send more trainers out in the future, please let me know. And she was like, okay, nice to meet you. I'm here for days. But I'm glad I did, because 6 months later, when I was signed off my training, I was given my letter to say you've passed your probation, and given the application to go out to India. So I applied to become a technical trainer, applied for a promotion, and I applied to go to Mumbai. And I found out, I think 5 days later, that I got all three. And so it allowed me to go out to India for 4 months to train folks to doing what I did. But it also gave me a whole different perspective on how the business was run, because I worked very closely with the alliance manager, where we were looking at business continuity planning, we were resource planning, all of these kind of things. And so it was when I was out in India there that I really decided operations is for me rather than science. Because in drug safety, you've got safety science or safety operations. And with a background in B-cell immunology, with, you know, so many biologics out there, that would have been a great fit, safety science. But I
Yes.
was, no, it's there's something about this business. My head saying, go down science, you've got a PhD, don't waste it. But the thing that really excited me was the business side and all of the operational side. And being out in India for those 4 months really confirmed that.
Yeah, and I think that's an interesting decision point, isn't it? In that I suspect a lot of people in your situation would have thought the same thing. You've got a PhD, don't waste it.
Mm.
Um, but I think it's difficult to say that you are wasting it, whatever route you go
Mm.
down, right?
Mm.
Because you accumulate all this experience and this knowledge, and then you never quite know which bits of it are going to come in useful at which points. But
Mm.
it, I suppose, there's a bit of sort of um, challenging your own programmed thinking a little bit on that. In that,
Mm.
you know, you can continue down this path of that you've been going down
Yeah.
and ignore this shiny object over here. But that shiny object might be the thing that you really love doing.
Absolutely. And I would say that, like, my PhD for me, yes, it taught me how to do various different scientific, you know, experiments and
Mm.
procedures. But the huge thing was the personal growth over those 3 years. Because when
Yes,
you're doing a PhD, no matter how engaged your supervisor or your lab mates are, nobody cares about it as much as you. The to be it If you aren't already a self-starter, it will teach you to be a
true.
self-starter. You know, for me, knowing that I had 3 years and that was it, and I would have to get a job after that, the time management and the control and being able to budget and negotiate prices and all of this. You know, I said it to somebody recently, it's like you're like a CEO of a little startup, but the
Mm-hmm.
startup is your PhD. And so there were times when I was first in that first role at Roche where I'd look at my peers and I'd be like, they came straight into this after a 3 year degree and they're at the same position as me. But if you then fast forward 5 years, where
Yes.
we were was very different. And that's no disrespect to them. You know, they were doing fantastically. But, you know, within 6 months, I got promoted to a drug safety specialist. I was out in India, I was training, and I was managing, you know, we were training, I think there were 50 people we were training. There's just two trainers on the other side of the world. And of course, we had our support from the folks back at headquarters. But I couldn't have done that before three.
Yeah.
Like, other people could have done it straight out. You know, my very close friend who I met at Roche, she was born with that, you know, that resilience and that confidence. I wasn't. For me, all of that leadership and self-leadership that I got from the
Mm.
PhD, I think from that point for, you know, to now, really has supercharged it. So what I would say to myself back then is, you're really not wasting it, because you're going to use that every day.
Yeah.
Yeah, topic wise, nobody, I think the next time somebody mentioned my science paper was 13 years later. I waited that long for anyone to care, but I knew it. And for me, it was like a validation for myself. Um, but, uh, but yeah, so it was interesting. And you also realize, I think, well, actually, if I have the business side and I've got that background,
Mm-hmm.
that's a real double bonus. Because, you know, the people that are coming into operations who don't have that scientific background, maybe, like, I couldn't do my job now if I didn't have the scientific background as well
Yes.
as the business. So yeah.
Yeah, and I think qualifications are interesting, right? Because it can be hard to see this at certain points in your career, but qualifications may well get you a job.
Mm.
Um, but as long as you're in an environment where there are opportunities to progress and there's you know fair development opportunities
Mm.
and you know I'm saying these as sort of standard things, but they're not always standard, obviously. But
Mm.
as long as you're in that sort of place,
Yeah.
then actually once you're in the job, the qualifications don't really matter so much, right? It's what are you delivering, how are you performing, how are you turning up every day? Those are the things that really matter. And
Mm.
actually it's everything that you've done that forms that.
Yeah. Yeah. And sometimes it can be things that aren't from somebody's professional life.
Mm-hmm. Yeah.
Everyone brings to the table their skills, their experience, their approaches.
Yeah.
And that can come through their degree, through volunteering, through a variety of different scenarios. Absolutely.
Yeah, I have a client who is a serial CEO of various different types of companies, and he's very good at it. And he credits almost all of his leadership skill to being the captain of a cricket team when he was 20. Because he had 14-year-olds and 50-year-olds on the same team, and he had to find a way
Yes.
to make it work and
Yeah.
all this kind of stuff. And so, yeah, it's absolutely, it comes from everything.
Yeah, yeah,
Yeah.
definitely.
And just before we move on to
Mm.
India and the next step of your career, because I do want to get into that. You mentioned something that I think is important, is that a lot of people don't really know what drug safety and pharmacovigilance are.
Yeah.
Can you give us a very short, for those who don't know, can you give us a very short introduction?
My kind of jokey way of describing it to friends and family is, you know, the piece of paper that everyone takes out of the box because it's in your way. That's my career. Um, but the serious answer is it's essentially all around the risk benefit profile of medicines. So whether it be in the clinical trial stages or after
Mhm.
drugs on the market, is looking at what are the potential risks and what are the benefits. So, for example, if you take a headache tablet and there's a potential risk of you losing your hair, the benefit is not outweighed by that risk. You are not
Yes.
going to, that is not going to be a positive risk benefit analysis of that. Whereas chemotherapy, where it's, you know, save your life versus that. So this is something that I remember at the beginning, you know, when you get a side effect report in, you categorize it as serious or
Mm.
non-serious. Serious is hospitalization or prolongation of hospitalization, medically significant incapacity or disability, congenital anomaly, life-threatening death, or other. And I remember it said, you know, hair loss, and I put that as serious. And like, no, that's non-serious. I'm like, but losing 70% of your hair is pretty serious. But again, it's trying to understand how they're all processed. So
Yes.
there's a constant review, and this is where, for example, you know, I think people became more aware of the process that medicines go through with the COVID vaccines.
Hmm.
But it's all of the different roles, and there's so many different roles within pharmacovigilance or drug safety. Everything from operations, where they might be making sure all the data is coming in and it's all being processed so it can be analyzed. Then there's the scientists looking at it from a risk benefit profile as well.
Yes.
So for me, I was always in pharmacovigilance operations. So all of my roles have always been around getting data from around the world, from all different sources, making sure that it's there so that the scientists can analyze and really understand what's going on. And it's important that that happens not only during the clinical trial stages, but also for the life of the medicine. Because once a product's approved, yes, it will have been tested in a huge amount of people, but there will be certain people that won't be able to be in those clinical trial
Yes.
populations, for example, pregnant women, or people with different disease backgrounds, but also long-term use is also really, really important. And so that's also something that I was really interested in, is really being able to work with medicines across the whole
Hmm.
life cycle as well. And throughout my career, I've worked sometimes very focused in clinical stages and sometimes post-marketing stages, but really, really interesting career pathways for folks. And certainly within big companies like Roche, you know, I've got friends that I started with back 17 years ago that are still there, and they've had incredibly varied
Yes.
careers. And of course, you know, the industry has changed as well. You know, there's a lot more different tools that are used now and things like that. So yeah, all about the risk benefit profile, and a lot of it is on that piece of paper that's in
Yes.
your package or the patient information leaflet.
Yeah, absolutely.
I
And
think
it's
that's the
amazing.
first time I've described it, Tom, in about 5 years. It's a bit rusty. So
I
apologies to any drug safety people listening to this.
Oh no, I'm sure they will have congratulated you on that. I appreciate we're going back a little while and you have stepped away from it a little bit. So we will plow on. Um, but India must have been amazing. And
Mm,
so you've made this big change then. So you've not only thought, okay, the business side looks interesting and this operations thing
mm,
is up my street.
mm,
Then you've also gone and moved to a different continent that's in different place and doing a different role, training people rather than doing it yourself. So there's a huge amount of change going on in your career and life at this point. But that must have been a very formative experience, I would expect.
yeah, absolutely. And it's it was really interesting because I have since then worked on both sides as a client and as a service provider.
Mm-hmm.
And being a client based at a service provider really makes you realize that you can't be, you know, I'm the client and this, that, and the other, because actually my teammates day to day, you know, I'm very anti-hierarchy. I always have been, always will be. And so going in there into a room of people who all knew each other, I didn't know
Yes.
them, I didn't know the company, I didn't know I didn't know the city or the country that I was in. You know, I'd been on holiday, but it's very different
Mm-hmm.
to living. But it was just such a fantastic experience because it really made me understand, I'd be speaking to my colleagues back in the UK and they're like, well, why aren't they just doing this? I'm like, but you have to remember when we trained, we had experienced people all around us. These
Right.
guys are all training at one go together. They can't ask an experienced teammate. It did put a lot of pressure on us as trainers.
Mm-hmm.
And people think that I can touch type because of my PhD. I'm like, no, I learned it in Mumbai because I'd be
Right.
typing so quickly because I'd have a stream of people asking questions, like a queue at my table. Um, but again, going from working on 3 or 4 reports a day myself to training people and answering questions on 50 reports a day and having to review them and mark them and feedback. The 4 months I was in India, I think I got the experience of being in drug safety for 2 years in those
Right.
4 months because I saw every different type of report. I had people asking questions that I'd not thought of before, but also it was just really great to learn to have the opportunity to work in another country.
Yes.
Because I think when you visit another country, you kind of see the touristy bits and this, that, and the other. But I learned so much from the folks there, and I'm still in contact. And what's amazing is that class, they are some of the most senior people on my LinkedIn now, all around the world. One of them is now one of the top folks for that service provider now based in the US. So
Right.
she's now in Cincinnati. And through my career, through various different pharmacovigilance roles over the years, I've bumped into those people. I've had an email from somebody from a different service provider where they've moved. And I've gone, hang on a sec, are you the same Devika from, 2007 in Mumbai? And they're like, of course, Rebecca. Because some of them know me before I got married. So they know
Yes.
me
Yes. Yes.
rather than Godfrey. But it was a real eye-opening experience. And it made me really, in a very early time in my career, understand how complex business is.
Mm-hmm.
Because I do think in the early stages, I was very much like, oh, well, why don't they just change this? And why don't they just change that? But
Yeah.
you see the size of a machine like that. And this is just a small segment of what the company did. But yeah, it was fascinating. And I would say that going to India was a huge catapult because having trained so many people, I then came back and for the rest of that year, I supported them remotely.
Right.
So I spent all my time on a mailbox answering questions, having phone calls with them, managing the resources. And then a year later, I went back out again for 6 weeks. And was a lovely thing is we got to take some of that first class and train them to be trainers
Right.
so they
Okay.
could self-sufficient. So our training team then were all the people in our first class. And we got to kind of move them along and make them more self-sufficient. So in the 2 years that I worked with them, it was really going from, ground zero. It was a very, very large service provider, a huge company in India, but it was their first drug safety contract to then making them self-sufficient. And I think that's why so many of the people in that first class are very senior now because they were the most experienced people there. But it was
Yeah.
a real lovely opportunity to go back, see people who are now friends, but also then be able to play a part in taking their next step up. And that allowed me that whilst I didn't have management experience, when I went for my first management job,
Mm-hmm.
I could say, well, I've trained people. And I'd done a lot of managing, not line management, but that is how I got my first management position.
Yeah. I see. Okay. And I have lots more questions about this, but we are still quite early in your career at this point, Rebecca. So I'm gonna fast forward a little
It's
bit.
like a 10-hour podcast.
Might have to do part two. Um, but as you said, you did go into management roles and you went into different types of organizations and different size groups and had that operational element to it, had that PV drug safety element to it for some time, but in progressively more challenging roles from the looks of things. But then you also developed some systems around leadership, some ideas around leadership, and that ended up with you writing a book, starting a business around leadership and sort of how to be more effective leaders. Could you tell us a bit about that?
Yeah, absolutely. So yeah, between kind of that time at that very early stage and what was Ethio Limited, named after my kids Ethan and Theo,
Mm-hmm.
my real bosses in life. So in the what would have been 12 years in between that, I'd had roles in very different organizations. So I left Roche after the India part. I went and joined a consultancy as a third person in the door. It was my first line management position. So there was an associate, I was the manager, and then there was a director. And in there, I'd had an idea on how we could expand the business.
Mm-hmm.
And the owners were amazing. And again, they would completely career changing that period, because they were like, yeah, if you think you can go with it, off you go. And it was about getting more. We were a drug safety consultancy, mainly focused on post-marketed products. I had an idea of, why aren't we providing more support to clinical trials and advanced therapies like our sister regulatory company was? And that really took off. And so within a year, I'd gone from being a manager to being one of the company directors and building out their systems. And again, I'd only been, in drug safety to less than 3 years at that point. But I had to make sure there was a quality management system. I was very lucky that one of the owners was our financial director. So I was a company director, but I had that mentorship as to how to accounts, how to make sure we had the right insurance, how did we contract with clients. But I was responsible for all of that. And I remember, being in an MHRA inspection one minute and then dealing with a recruitment issue or a health and safety and all of this. So that was relatively early. And then I went back to Roche as global head of regional pharmacovigilance excellence, which I oversaw the 92 country operations. So again, great to go back to where I'd kind of grown up,
yes,
but in a more senior role. And again, I think having that PhD experience and then the 3 years at Diamond building that consultancy allowed me to accelerate my career. But the reason why I mention all of this is that when I went, my last role in drug safety was at AbbVie as global safety compliance director. And while I was there, I was asked a question, and it was just a icebreaker question in a workshop. They said, what would you do if you had no fear? And it's such a, silly little question where people are like, oh, I'd be a superhero, I'd be Batman or whatever. And to me, it was like this existential crisis I was going through. Like, what would I do? And I think it was, again, another time in my personal life where there'd been a lot of change. I'd lost my dad that year to motor neuron disease, completely different situation. My mum was very sudden, whereas with my dad, we got a diagnosis and then had 2 years,
right,
really tough 2 years. That I was like, what would I do if I had no fear? Because, 6 months prior to this, I was with my dad at his bedside thinking, I need to remember this because I've thoroughly enjoyed my career and my life, but I also sweat the small stuff sometimes. So when I was asked this question in the workshop, I was like, well, the thing that I fear most has happened twice to me. So what would I do? And I remember saying to the lady, I do what you're doing. And she was running a workshop. And 3 weeks later, I spoke to my boss and I said to her, I think I'm going to leave and go out on my own. And she was like, what? You've been here like 5 minutes. I'd been there 4 months.
right.
I remember saying, if I leave, it's going to look like I didn't pass probation. And she said, don't worry, I'll put anyone straight. Like, go and do it. Like, life's too short, go and do it. And when I went out on my own, I had the safety net where I'd contacted Diamond, this consultancy that I'd built over those 3 years. And they brought me back in as a consultant 3 days a week. So I continued to do pharmacovigilance, working in this consultancy with the people who were my first ever direct reports, albeit 10 years later. And then I was going out and doing team and leadership development workshops. But it was at that time that somebody who approached me to work on a big pharmacovigilance contract, they wanted kind of some big names that were known in the industry. They said, would you come and be on this bid? But one of the things they want to do is they've looked across your career and you've made, big changes. As I said, I'd always been brought in to build or to change. And I made some quite big changes at some of the big companies, as well as build this very successful consultancy. They said they want you to do a presentation on how you've done it. So I was thinking, oh God, I don't know. Like it was really hard work, but it wasn't that difficult. Like I never really got like, what was it that, why, me and my teams would come in, we'd fix it or build it and go, okay, that wasn't that difficult. And I don't mean that in a big-headed way, but it just didn't seem as difficult as I think sometimes people were making it. And so what I did is I sat down in this office with a whole load of flashcards and I wrote out all of the various initiatives I brought in as global head for regional PV excellence at Roche, and what I'd done at Diamond and what I'd done at AbbVie and ASI and all of these different roles that I'd had. And it was so bizarre because they all started to fall in. They were very different activities, very
Right.
different roles, often kind of global overseeing roles. But right from the small consultancy all the way up to, biggest companies in the world. And it was the same pattern. And this is what then ended up falling into a book, because it was the same 5 pillars, which I now call culture, scope, structure, staff development, process excellence. By getting the right culture in place, having the right vision, knowing why we're here, what we're doing, either on a team or department level or on a whole organizational level. What is our reason for being? What's our North Star? And what do we do every day to get there? What are our team values? Got that right. Then scope. What are we and what are we not? So I was inheriting a lot of departments where they were like, I don't know if this is us or that interfacing department, or a consultancy saying, do we do all these clients or just this niche?
Yes.
So getting that clear, then getting the right structure. Again, anti-hierarchy, distribute control. It can't all be in the head of the leader. Get subject matter experts, empower them to drive, a bit like we do at XEd. And then staff development, because if you know then what roles, then you can develop not only their skills, but also their confidence. And then lastly is process excellence.
Mm.
If you've got really confident, highly skilled team members who are empowered, who know where they're going and know the scope of their boundaries, they will build the most amazing systems that they will own, and therefore they'll live and breathe them, rather than I'm just doing Rebecca's process.
Yes.
And it was through doing that bid, a pharmacovigilance bid, that I was like, hang on a sec. And I kept testing it on the roles that I hadn't looked at. Like, let's go back to like when we were in India. Like, what did we did those 5 pillars. And for all of the roles, let's say it was really hard going for the first 6 months. I'd be like, what happened at month 6? Well, it was the 5th pillar that went in.
Yes.
And sometimes it wasn't in that order. Sometimes if I was taking on a team that wasn't working well, they may have 4 of them perfect. And that's why nobody can understand. Like, these are a team that have got a great culture and they've got this. Yes, but they don't have clarity of scope.
Mm.
Let's fix that. And so time and time again, this worked. And at the time, I was doing these team and leadership development workshops and building this leadership development program for senior leaders in pharma and biotech. And I was on an entrepreneur accelerator, and one of their big pushes was, if you have a methodology, a way of doing things, get it out there.
Right.
And through doing that, I got involved in the Business Book Awards as a judge. And it was on the first judging day that the founder of the Book Awards, Lucy, came up to me and said, right, when are you going to write your book? And I was like, I don't have a book in me. There's no way. And she said, you have to write a book. And I remember saying to her the following year on judging day, going, I actually published, and I published it with her publishing company, but I never thought of myself as a writer. But having that clarity and that structure and testing it, I became so passionate on getting it out there that somehow the book came to be, which was, it still feels very strange 3 years on.
And this was the leadership vaccine.
Yes, which is not the best title to have if you're going to launch it in April 2020.
Or maybe it is.
Well, some of the nasty messages I got on LinkedIn from random people.
Oh, really?
I did get trolled a bit because people thought I was jumping on the COVID bandwagon, in their words. But it was a nod back to my immunology background, and it was all about vaccinate your leaders and secure the future of your teams. Let's make sure we are developing leaders, and especially I would say in our industry now, where you have a lot of founder leaders. They don't have, I went through being a leader by getting 360 feedback, and no matter how senior I was, I always had bosses above me. Whereas now we have a lot of leaders that have never had a boss, and they've never learned how to manage by being managed. So more than ever, we want to make sure we arm these folks with the skills and the awareness, importantly. And so there was due to be a program that was launching in March 2020, and then something happened in March 2020 that changed all that. But the book went out in April, and it did so much better than I expected. And I think my claim to fame to my 11-year-old was that he wasn't interested that I got a #1 bestseller. He was more interested that I got knocked off the top spot by 50 Cent. So me and 50 Cent were in the same sentence at one point in my life.
Well, if you're going to get knocked off the top spot, then might as well be by 50 Cent, right?
In a HR category as well, which was really strange.
I have so many questions about that. Yeah, but I think it's a good point. I think it's, we are in an industry and in the world in general, there is some of that requirement to build your leadership skills over several roles and several progressions is gone, which I think in a lot of ways is a good thing, because it accelerates bright people, and it gives people more opportunity, and it can remove some of the maybe embedded thinking that comes with progressing gradually. But at the same time, it's there's not a set way to lead a business or to lead a group of people, and there are lots of models out there, and there are lots of theories, and there's lots of ways to do things. And I think, rather than there being one that sort of stands above them all, I think the more clarity people can give on different ways to think about these things, the better, because different things will apply to different situations and will play to different people's strengths and all that kind of stuff. And I think it's, there's a lot of leadership material out there that is just a really good way for the publishing company, usually not necessarily the author, to make a little bit of extra money by giving something a different title. But clarity is really hard to find, I find.
Yeah, absolutely. And I think, when I first set about writing the book, I spent a day with a book coach to go like, how do I start? How do I structure this? And coming from a academic science background, I felt that this needed to be a textbook. And I don't think I consciously realized that.
Right.
But he said to me, Rebecca, you always talk in stories. Anytime you're trying to illustrate a point, you'll illustrate it with a story, a random story. So he said, why don't you write it as a story? This was before I'd read things like I hadn't read Five Dysfunctions of a Team and all those. Patrick, is it Lencioni or Lencioni? He writes his stories. I'd never read a book as a story. Afterwards, I was like, darn, I thought I was so unique. I wrote it as a story, and I'm so glad I did, because it illustrates that this is one leader's story.
Yes.
One leader's journey. These are things that, because all of the tools in the book were things I'd genuinely used. So there's one called Scoping Walls. I dreamt that up on a flight to Chicago to go and see my team when I was at AbbVie. And I was like, okay, if I got Post-its and it was literally like, just use that wall for this, that wall for this. But then I've used it ever since. So some of the tools were just out of my head. Some of the tools were existing tools that then had evolved over time into what I needed them to do. But it's unlikely that somebody's going to read the book and go, every tool worked for me, and every tool. Now, sometimes I do get people who know the book better than I do. And it's really like, God, especially because there's characters' names that I changed at the very last minute. People go, oh my God, I'm so like such and such. And I'm thinking, who's such and such?
Yeah.
But I also get messages from people going, oh my goodness, this sounds like me. I really needed this. And so, yeah, absolutely. Like, it's one way. I launched the book, and then because of these messages I got, I didn't really promote the book at all. And my son said to me the other day, does it ever upset you that it was a complete waste of your time that you wrote that book? I was like, thank you, darling. But for me, lovely little kids. But so I told you, they're my bosses, really. But it has been really valuable. Like, even things like when I've gone to join a new company, I remember my current CEO last summer said, oh, I've just finished your book. And I was like, oh my God. And I'm like, well, because it's written as a story, anyone who knows me says that they can hear me through the book.
Right.
So I said, well, if you didn't like the person in the book, don't hire me. But it was a great way to kind of, consolidate my thinking. But those who have read it and who have got in touch with me, the feedback's been really nice, because they're like, it actually speaks about the problems we've got in our industry.
Yes.
Because I do think, the tagline is for highly regulated industries, because I also worked with folks in fintech and other regulated industries. But this, having this drive to innovate, but also we've got regulations. In a startup, it may not be, healthcare regulations yet, but it's going to be business regulations. It's going to be HR regulations, finance, insurance, all of these things. And having that balance is something I was really passionate about doing. But also, I think it's brilliant that we've got founder leaders now. And some of the best leaders I've ever met have been leaders that have never had bosses.
Right.
What's difficult is I feel they didn't have the support that they could have had. But actually, yes, I think we all know leaders that could be stronger leaders, but certainly, in my experience, the people that I've worked with have been incredibly positive, and actually this could support them, but they've got the right aptitude.
Yes.
What I've been lucky is I haven't worked with those who didn't have the right aptitude that are leaders.
True.
But I'm sure there are some out there.
Yeah. And I think you mentioned something there that I think is particularly important, is that capturing this process that you'd kind of unconsciously gone through several times was really important for you. And I think you touched on this earlier as well. I think a lot of people who've been successful in their careers or have successfully led change or turnarounds or whatever it might be would probably struggle with that question of, well, what did you do? Or why have you been able to do this over and over again? Because, it's difficult sometimes in hindsight to see those things. So, it's an interesting point that sometimes it's probably worth writing these things down, right? And capturing them.
Absolutely. And I would say that, writing the book completely changed my career as well, because just as the book came out, like, it was a really weird experience. The book comes out, it did well in the UK, and I kind of thought, oh, maybe that's just friends and family. But then it started to do well in countries around the world. And then the imposter syndrome hits. But what people probably didn't realize at the time is I'm like #1 in 5 countries, but I was closing my business at the same time, because everything that I'd invested and built up, I was either doing in-person workshops, team and leadership strategy workshops, couldn't do those. I was about to launch the leadership vaccine program, couldn't do that, thought to pivot online, but then I was looking around at friends and family in the industry thinking, they don't have time to do leadership development right now. And so, I was scrambling, thinking, for the first time in my life, I'm unemployed. What am I going to do? And it was just by chance I saw a chief of staff job ad and only opened it because I didn't know what a chief of staff. I thought, it's the White House. What does a chief of staff do? And bizarrely, this chief of staff job at a gene therapy company, Freeline, it was my book. It was the 5 pillars of my book. And so I applied to that. And I remember, this was maybe a couple of weeks before the launch, and I remember having one of my interviews the day after the launch, and the interviewer asking, like, oh, so what are you up to? Like, joking, because obviously everyone was locked down. And I said, well, I launched a book yesterday. And he said, how'd it do? I said, well, it's currently #1 in 5 countries. He did say it was the best answer ever in an interview.
Yeah, I'm sure.
But it allowed me to then go into the pure business side, because having stopped and written a book, I realized that, yes, whilst I was a senior leader in pharmacovigilance, what I was a senior leader building organizations and teams. I'd built a company from the ground up before. I then built kind of organizations within wider organizations. And so it allowed me to then move into the chief of staff role and then into the COO role. So this is my second COO role now. And that's what I was saying at the beginning of our chat. I never would have seen me going from being a senior pharmacovigilance leader over to then kind of more pure business. And then I got to, in the gene therapy and now in ExpressionEdits, pull back from my PhD. And that's where it kind of all starts to come full circle. But I honestly don't think, had I not spent those 2 years out helping other leaders build teams and companies and having to really be able to articulate, how is it that I've done what I've done, would I be able to be doing the role I've done now? So every day there's things in my role that pull from all of the roles I've had over 17 years, as well as my PhD. But every so often I do sometimes, like, it's great to have a book, because it's like having a notepad. I'm writing out a new tool. I'm like, let's just refresh myself on my own tool. So it's been interesting. But right now my career makes sense. And if we'd had 25 hours, I could have told you in the in-depths of everything. But it all makes sense now, because you need to have that variety when you're in a startup, because every day startup is going to be different.
No, absolutely true. And as you say, there's much more to go into in your journey. And I certainly still have lots of questions. So maybe we'll have to do a follow-up on this. But Rebecca, it's been so good to talk to you about this. Thank you so much for taking the time.
No, thanks so much for having me. And thank you for this podcast. As I say, when I first got in touch with you, it's a great podcast. And I do think it's a really important one for folks to listen to. So thank you.
Thanks very much for listening. Careers in Discovery is sponsored by Singular, helping you to build a brilliant biotech company. Biotech leaders spend far too much time, money, and energy on hiring and people issues. Head to www.singular-biotech.com to learn how you can recruit and engage your team more effectively so you can focus on developing medicines, treating patients, and saving lives.